Welcome to another presentation by My Weight World. The title of this presentation is Liposuction Part 1. This presentation is designed to give you a brief overview on the topic of liposuction. I will be discussing Part 1. Introduction. There are 3 parts to the discussion of liposuction. Part 1 will cover what is liposuction, parts of the body it can be used on, locations to have liposuction, doctor issues, regulation, when it is not right for you, alternatives to liposuction. What is liposuction? Liposuction is a surgical procedure that removes fat deposits and consequently shapes the body. Fat is removed with either vacuum suction, cannula, a hollow instrument like a pen without the ink insert, or ultrasonic probe that breaks up the fat into small pieces and is then suctioned out. Is liposuction weight loss or body contouring? Liposuction is used to remove localized fat deposits to help shape the body, not recommended for weight loss in general. However, small amounts of weight are lost just by removing the fat. Typically, a few pounds to 15 pounds will be lost per procedure. What parts of the body? Liposuction can be done to many different parts of the body. Typical areas for body contouring: abdomen, hips, thighs, calves, arms, buttocks, back, neck, face. There are other indications for liposuction besides body contouring: reduced breast size in many males, gynecomastia, also can be used to remove fat tumors, lipomas. Liposuction can be done on more than one area at a time. For example, abdomen and thighs on the same day. Who performs liposuction? Any U.S. licensed physician may perform liposuction in the United States. Other countries may have different rules. No standardized training is required. Consequently, the experience and training of doctors performing liposuction can vary greatly from one to the next. Typical physician performing liposuction is a dermatologist or plastic surgeon. Other doctors, however, can perform liposuction. Where is liposuction performed? It can be performed in a doctor's office, surgical center, or hospital. Key points of any location. This is surgery. Make sure you are in a clean environment, that emergency equipment is available, and there is a quick transport to an emergency room if the surgery is done in an office or surgical center. Let's go over some issues on finding the right doctor. It's your right to ask the doctor and his or her staff questions. Remember, you are paying for a service, and you should have all of your questions addressed. Advertising. Be cautious of advertisements that say or imply that you will have a perfect appearance after liposuction. This is surgery. It's designed to improve your appearance, but hardly ever is perfect. Cost. The cheapest is not always the best, nor is the most expensive always the best. Recommendations from friends who have had a good experience with their doctor are helpful. Occasionally, the doctor may have references you can talk to who are willing to discuss their experiences. Be cautious of the references of staff who work for the doctor. They may be biased. Research the procedure on the Internet, through other resources, and the literature provided by your doctor. Consider evaluating more than one doctor. Don't feel pressured to sign up with the first one you talk to. And finally, ask the doctor questions about his or her background, what their specialty is: dermatologist, plastic surgeon, other. Did they have formal training in liposuction, and if so, where? How many patients have they done liposuction on, and how many of the type you will have done? For example, They have done 500 liposuctions in general and 50 abdominal liposuctions which you plan to have done. Ask them what their complication rate is. Ask to see some before and after pictures of the type of procedure you are having done. Again, many doctors will let you talk to prior patients as long as the past patients approve first. Regulation. The FDA, the Food and Drug Administration, regulates medical devices such as the ones used in surgery. The FCC, the Federal Communications Commission, regulates advertisements. Each state is responsible for issuing individual medical licenses for a doctor to practice in their state along with the facilities where the procedures are done. Actual direct regulation of the liposuction procedure is not really done. When is liposuction not right for you? Risk. Reconsider if you expect the procedure to have zero risk. This is impossible. Cost. The majority of insurance companies hardly ever pay for liposuction. It is considered a cosmetic procedure. Weight loss expectation. Liposuction is designed to shape the body, especially localized areas of fat. It is not recommended for primary weight loss. Liposuction is not right for you if you have certain diseases that increase your risk and/or affect wound healing. For example, if you presently have an infection, or if you have a history of bleeding, blood clots, thrombophlebitis, significant swelling, or other. You and your doctor should discuss the risk-benefit ratio of the procedure. Liposuction may not be right for you if you are taking medication that affects wound healing, causes bleeding, or interacts with drugs used during liposuction, including aspirin, which can increase bleeding, non-steroidal anti-inflammatory agents, anticoagulants such as Coumadin and heparin, which can also increase bleeding, and any other medications. Please discuss this with your doctor. And finally, liposuction may not be right for you when it comes to your skin. If your skin is not elastic enough, it may be baggy after liposuction. Your doctor will, or should, be evaluating you for this. Alternatives. Liposuction is cosmetic more than 99% of the time. The decision to have the procedure then is elective and up to you alone to decide, not your doctor. Alternatives to liposuction. Diet to lose or shrink some excess body fat. Exercise to tone up problem areas. Accept your body as is, or using clothing or makeup to downplay or emphasize body or facial features. Summary. Let's now summarize Liposuction Part 1. Liposuction is a surgical procedure that is designed to sculpt the body by reducing or eliminating local fat deposits. It is not designed for weight loss. Any licensed U.S. doctor can perform this in the United States. It is performed in doctors' offices, surgical centers, and hospitals. Since it is almost always elective, the patient solely needs to make the decision to proceed or not. Check out carefully the doctor and location of the procedure. Ask questions. It is designed to improve your body cosmetically. Rarely does it make a body part look perfect. There can be complications. Please see the next series titled Liposuction Part 2. This has been another presentation by My Weight World.